What's good, y'all? It's the Demouchets REACT, and we're back with another video. Who we got today, Steve?
Today we're back with another American reaction. So excited about this video. If you're new to us
and we're new to you,
make sure you scroll down,
hit that subscribe button,
and turn on the post notification bell.
Because we're on the road to 200K.
And we cannot get there without you guys, right? Join the family. Without further ado, let's get into the video.
Let's get it.
Here's why it's better to have a baby in Finland than in the US.
Ooh.
Kela is the Finnish government agency that provides social security benefits. Meet Kela communications specialist Anina Kuokka.
Kela is a Finnish social security institution, so basically most of the Finnish social security benefits are granted from Kela. And we have all kinds of benefits. We have benefits for children, benefits for illnesses, and pensions.
In 2019, Finland gave out 9.3 million euros worth of maternity grants. Thanks to Kela and higher taxes, childbirth costs are totally covered for Finnish residents. New parents may expect to pay for the hospital room out of pocket, but that's usually it.
When you go give birth, it's almost free. We stayed in the hospital for 3 full days. As a family, we had our own family room, and we got like meals and support and help and everything, and the bill was about 300 euros in the end, you know, for the whole. It's basically like living in a hotel.
In the US, it's a different story.
300 euros?
300 of them.
100 of them.
First of all, let's just talk about the fact that women have to pay to give life. Respect the fact that it makes sense when you are having to pay to give life and they're covering everything, all your expenses, but you have to pay to give life.
Contributing to the population of the country.
It costs.
Child.
Like when you gotta, sometimes you gotta say it out your mouth to see how it sounds first, instead of just looking at the picture and be like, interesting. It costs though, for real.
Get safe care. A safe delivery.
But yeah, though.
Sometimes
I already know where this. Hey, listen. I already know this video finna go.
Yeah, that's a whole nother story. Cause I said safe, but.
Both born at NYU. The cost out of pocket for both my children was around about $2,000 per child.
So I got pretty lucky because I had really good insurance, and I only paid $250.
Why such a range? Dr. Michelle Moniz co-authored a 2020 study about the out-of-pocket costs for childbirth in the U.S.
In this study, we found that women's out-of-pocket costs for maternity care are rising over time, from approximately $3,000 at the beginning of the study period to about $4,500. It can be very difficult for patients to predict beforehand what they might be on the hook for in terms of costs. One really important finding in this study was that it's the deductibles.
Deductibles are getting higher, meaning people are required to pay more out of pocket before insurance kicks in. So even though the cost of birth has plateaued, the out-of-pocket costs are on the rise.
I called the insurance company to get like a quote or an estimate. It was really hard to like get a number. They told me to call the hospital and just kind of went down a rabbit hole. So I didn't really have an idea, and I expected a lot more.
Emily Oster is a professor of economics at Brown University and a mother of two. She's written 2 books about the convergence of her professional and personal life as a mother.
In terms of like how much any individual person pays, that's also very hard to predict because it depends both on the co-pays associated with your insurance, also how far you've gotten in terms of your deductible, do you have a health savings account? So there's like 1,000 layers of things that we deal with in the US insurance system that would be different than a place with more of a sort of standard single payer model where it wouldn't matter what kind of insurance you have, there's only one kind of insurance.
Why are rising out-of-pocket costs?
Hold on. Now, thankfully, we have had insurance with all of our children, but the first 2 were fully covered. It was still a high bill, but the 3rd one, that's when we had to come out of pocket with some of the costs, and that was ridiculous. That was ridiculous. The highest bill that we received, I'm not going to say y'all the number, I've said it before, but the highest bill was our 2nd child, and that's because we had to use the OR, but I still gave a vaginal delivery with him, but it's like I got charged for both types of deliveries.
they running past me talking about they gotta take her to the other room. I'm like, whoa, and they didn't want to let me get in there. So it's like, because it was supposed to be an emergency and this, that, and third, which is,
They didn't want to listen to me.
Right.
And they didn't want to listen to me. They didn't want to wait on my doctor. And they still had to wait on my doctor.
Yeah.
And then when my doctor came, my doctor listened to me.
But she still got billed for just touching the table.
Yeah, just sitting on it for a second.
Yeah.
It's such a crucial issue.
When I see that kind of a cost, I worry that patients may choose to delay or defer some of the healthcare services that we recommend
A lot of
for them
people
during
do.
pregnancy, things that we hope will improve outcomes for both mom and for baby.
From an insurance perspective, there are a few ways to go about cutting costs.
I think it's important to retain choice, and some people would like to have a doctor, and there are many excellent obstetricians, but I do think that more midwife births with low-risk women is a way to save money. Midwives do tend to be less expensive, and in the sort of context of a hospital birth and so on, there's absolutely no reason to think that they couldn't do a fairly large share of low-risk births.
At the Helsinki University Hospital in Finland, midwives are the norm.
I have been midwife for 10 years, a little bit over 10 years now. Within 10 years, it has been a little bit less than 1,000 births. We don't have a doctors in the births, only if there's any complication, then the mother will see a doctor. But if everything goes normally, it's just midwife. It is a lot of responsibility. Finland is one of the most safest countries to give birth. And we also try to, as much as we can, listen to the mother's hopes and wishes, what she wants to do. And the whole family can be together most of the time. So also the spouses can be with the mother most of the time. So I think that is the best part.
Things weren't always so
I was
efficient.
gonna say, man, real quick, shout out to the midwives, because their job is hands-on and they are in the sense replacing the doctor, but they are doing it in more of in a way that they feel like the woman is more comfortable with. But whenever things go left, you know what I'm saying, the midwives do take a big hit on that type of experience, because it's not the hospital that's being told that something happened. It's that one individual as a midwife who's saying that this is not on your resume. You know what I'm saying? You know where I'm coming from? So they have to live with that as they go on, with their career, to continue saying that they're a good midwife.
Right.
Sometimes it's not their fault, you know?
Right, because they're already looked down upon. And I'm not saying in Finland, but in the U.S. they are. But when you look at the history of childbirth in our country, it started with the midwives. The midwives were the ones who were helping to deliver the babies. It wasn't until the doctor, so I'm thinking what I'm thinking of. Okay, I'm getting my dates messed up, but it wasn't until like they needed all of the certifications that the doctors replaced them. Like they had to go to the doctors. But even still in our rural communities, it's still midwives.
Finland. The infant mortality rate in the 1930s was so high, the Finnish government devised a plan to improve it. Enter the baby box.
Oh, I love the baby box.
Back in the days when the box was designed, the box was meant to be a safe and clean place for the baby to sleep in, as some families were so poor they didn't have a safe and clean place for the baby to sleep in.
The free box was incentive for new parents to sign up for the public healthcare system. They couldn't get the box without visiting a doctor. Today's baby box has 63 items for both the baby and parents. New parents can take the box or a 170 euro stipend. About 95% of first-time mothers choose the box. But the contents of the box are worth much more than 170 euros. Companies vie for a spot in the baby box, and it gets competitive, so the contents are usually pretty high quality.
If you go to a store and buy all the products that are in the maternity package, you would probably have to pay a lot more than 170 euros.
Anu Partinen is a Finnish journalist, mother, and author of The Nordic Theory of Everything. Before she gave birth in the US, her friends managed to send her a Finnish baby box for her newborn.
It's a cherished tradition, but all the stuff in it is really nice. It's not some low quality charity thing. It's just the really helpful, wonderful thing that makes you feel like I'm being cared for and the whole country is providing for your child.
There are even some copycat boxes online that go for over $400.
Good job.
So, what do parents in the U.S. get postpartum?
Oh Lord, here we go.
Let me say you something.
Here we go. Get 3 nights in the hospital. Let's start there. You get a hard
That you
bed for the
pay
men.
for.
Talk about us brothers now. We don't get a bed. We gotta sit on the wall. Anyway.
We rack up on everything that they have in the baby cart.
We have to depend on our village to, you know, support the baby with gifts and, you know, things of that nature. Welcome, you're a new part of the family type stuff, you know?
Yeah. For the boys, the hospital gave us a $50 coupon to get something to eat. Yeah, that was nice. That's about it.
They gave you ice to chew on?
They did, but I paid for it with the bill. I paid for everything that happened with the bill.
So terrible.
I remember I asked for some extra medicine because that delivery was so hard for me. She's like, "You want some medicine?" And I'm like, "Yes." She started bringing it up on the scanning it to go in my file. I saw the bill. I'm like, you know what? Oh well, I needed it, but every single thing costs.
That's crazy.
Everything.
That was it. A hat and a blanket.
You get advice, you get phone numbers you can call as far as lactation consultants and nurses that can help.
They gave me some like baby products and maternity care products, and the nurses are pretty liberal with like giving me as much as I want to take home.
I think I didn't get anything the second time because I was not at the hospital very long. The first time I recall distinctly getting the squeeze bottle and the extra mesh underwear.
What do American parents want or need?
The information is as important as the stuff.
And I'm a first-time mom, so I didn't really know what I needed. I was like calling all my mom friends, like, what do I need? And trying to gather everything.
You know what? I feel like the hospitals do a good job with the resources that's available.
The information is
like all of the advice, like what she said, the lactation consultant. What I would have liked was a doula.
Okay.
Like, of course, for the third one, we not new to this. We true to this, right? We know everything we need. But a doula to be there with you for the first weeks, like the first 6 or so weeks, like that person.
Yeah.
I would have loved to have more practical advice. So even with my medical fund of knowledge, there are so many things that you learn when you're home by yourself with a newborn.
One thing is the box, which everybody sort of focuses on, like, okay, there's this great box, it has all this stuff in it, but I think it is really emblematic of a much larger difference, which is that in many other places you get a lot of social supports after you have a baby. There's a home visiting program, there's, you know, different kinds of help, and in the US we don't have the box, but we also don't have those things.
Another great Finnish mainstay is generous parental leave.
In Finland, you get 10 months of paid parental leave.
Bro, so when I'm listening to all of this in Finland, this is the expectations I see the future developing to. You know what I'm saying? It's like for the people, like literally for the people type stuff. Like things that's gonna literally put people in better positions to be, for instance, when it comes to pregnancy, when it comes to job related, when it comes to just anything, like things that's gonna better people, for instance, like this, should be in the picture of the future.
Right.
I don't see how they keep skipping over stuff like this.
Right. Hopefully soon we'll get it. Hopefully.
Yeah.
I don't know how soon. I don't know. A couple years. But and I also would like to see that the focus is not just on the mom.
Yeah. 100%.
The focus needs to be on the dad as well.
Yep.
That's a unit. You
Thank
know.
you.
Like for our third baby, like we did everything different.
Right.
From deciding to go to a midwife to actually having parental leave for you. Like we did everything different.
4 months is set aside for the mother, and you start it before the baby is born.
And here's the thing though, a lot of people like to say, you need to tell your story, you need to tell your story. A lot of the reasons that you guys get to see us do the stuff we do is because of the changes that we wanted to see in our lives. Before the story even hit the media, before we even told everybody what the looks like, so what the ups and downs were, we looked at it for ourselves and we, you know, calculated the moves we needed to make, and then we repositioned ourselves, because if it wasn't for our own sacrifices, a lot of the things like me being for our daughter's home birth wouldn't have been possible. You know what I'm saying? So
exactly.
Yeah.
Could you have imagined me there by myself?
Oh no.
Ooh, me
Oh
either. I
no.
can't even imagine that either. I went to
You'd
another
have been
dimension.
left. You'd have been. That's what you did for our firstborn.
What I did?
You had to go straight to the hospital. You was you hit the dial button and you was out. You was on ASAP. And me, I had to work that day. So you can only imagine.
And for the second one, you only had a week off.
Yeah. And then for the third one, I was off forever.
He was off forever.
I was there the whole time.
Keep 9 weeks. Typically, parents stay home for the first 3 weeks. They share the rest of the time until the baby is 9 months old. A parent can even stay home until the child is 3 years old and keep his or her job.
Wow.
However, the stipend is much smaller. In February 2020, Finland proposed increasing parental leave so the father's time off matches the mother's.
Love that.
There's no federally mandated paid parental leave policy in the US. The Family Medical Leave Act provides eligible workers with 12 weeks of unpaid leave to care for a child.
My sister-in-law, she didn't get any paid leave and just had to use disability and then was unpaid.
Policies that allow
even disability is something I see in the future they need to invest. They need to increase
of their child's life, including paid parental leave policies, could have a profound positive impact on outcomes in this country. And I would love to see more employers adopting those kinds of policies.
As the issue gains more traction, more U.S. employers are increasing paid parental leave.
The evidence is quite strongly in favor of the idea that some kinds of parental leave, maternity leave in particular, benefits mom but also benefits the baby. So I think there's pretty clear reasons to introduce some parental leave.
Increased paid parental leave may intrigue American parents, but there is one issue that's overlooked. Maternal mortality rates are on the rise in the U.S.
Talk about
it. It's the only developed nation where this is happening.
As a clinician, I can tell you there are many, many causes to the rise in the maternal mortality rate. Things like difficulty accessing healthcare services, both in pregnancy but also before a pregnancy. So somebody who's having trouble accessing stable housing is going to have trouble accessing medical care and doing all of the things that help keep you healthy during pregnancy, taking a prenatal vitamin, staying hydrated, eating a healthy diet, exercising. So I think there are many, many contributors to the outcomes that we see, and we need interventions at multiple levels to try to improve those outcomes.
Finland, on the other hand, has...
Well, it's not just the social aspect of it. It's the actual staff as well. Like earlier, what I was saying was the nurses were not listening to me. The doctor that was on duty was not listening to me. When my doctor came in, she listened to me, and I had the outcome that I was supposed to have. I was lucky. I was blessed in my situation. But there's so many other parents who went to that same hospital who had very bad situations and outcomes.
Yeah.
So, and look at the statistics with my community. I don't want to get into it, but go look for it yourself. It's all out there.
One of the lowest infant mortality rates in the world. It was also rated the 6th best place in the world to raise children in 2020. The US was ranked number 18. And at the top of the list, Denmark, followed by Sweden and Norway.
The Nordic countries.
That said, it's not all bad.
There are some things the U.S. does very well, and I think it's important not to lose sight of that. In particular, if you have a very complicated pregnancy or a very complicated infant health situation, the healthcare setup in the U.S. is actually really quite good. I think where we are experiencing a lot of inefficiencies without a lot of benefits are in the kind of low-risk space.
Other countries are taking note of Finland's success. Scotland began offering a version of the Finnish baby box in 2017. And Japan offers subsidized childcare to low-income households and free preschool for all to increase the overall birth rate. In the meantime, what can American parents do to prepare for parenthood in the U.S.?
Be really careful when you're selecting your health insurance plan. Calling your plan and asking about specific services is one way to try to better understand what services you might be responsible for.
Dr. Moniz says it's important to know the out-of-pocket costs from your insurance plan for services like prenatal office visits, lab work during pregnancy, ultrasounds, fetal testing, childbirth, and postpartum visits. For now, the Finnish model may be a pipe dream for the US. But as 2019's happiest country in the world, perhaps Finland is onto something.
All right, we're going to stop right there. And that was going to be my answer. I feel like we as people just need to educate ourselves, which is kind of crazy because we have so many positions that are open where they're supposed to give us the tea, as I'm going to call it. You know what I'm saying? Just to keep ourselves in a great position when we come across situations that we haven't experienced before, for instance, as a new mother or a new father. But yeah, it's us. We have to educate ourselves to the T, because when you walk in these rooms and you tell them the base information that you know, then they get an indication to say, okay, this person knows something. Let me be a little cautious of how I treat them going forward, because people don't want to get sued.
Yes, because our third baby, like, we were very, very experienced parents, okay?
Took 3 times.
It took 3 times. But when it came to, like, how they talked about the insurance, we called the insurance, like, hey, we want to go this route this time. We're not going to the hospital. We're going through the midwives, okay? And so they told us everything we needed. And at one point, they told us something that we wouldn't be able to do, so we switched over to a different plan. And that worked out for us. We did have to, like, cover our costs because an issue came up with me, not necessarily the baby. So, just different things like that. We got the doula, like I said. Everything the third time was a charm.
Yeah, learn something. Just learn something, man.
But I do hope and pray that sometime in the near future, I'm not having no more kids, but for the other parents, that they just give better resources, better time off. Would love to see some grants like what they have given to the new parents, because parents need that. They need to, like, we're such in a rat race that we can't afford time off anymore. But parents need to be able to have time with their babies and heal. Women need to be able to heal. They have a womb. After they have a child, they need time to not have to worry about finances. So I would love to see that, and that's regardless of how much they make. So love to see that sometime in the future.
100%.
All right, y'all, we hope you guys enjoyed this video with us. Be sure to subscribe. We'll see you soon.
Peace.